Almost. Hi, everybody. Welcome to Sunday Night Live. I want to welcome all of my viewers who have shown up tonight and all the people as well on Dr. Tony Hampton's channel because it's streaming there as well. Welcome, everybody. My name is Anita from Ketogenic Woman. I have just a couple of quick announcements. I want to let you know that Bonnie and Melissa are in the comments. You will see their names in there. They will be crowd control, leaving links, that sort of thing for you guys if you have need of any of that. We do have Dr. Hampton here tonight, and I'm going to introduce him in a moment. I just quickly, for the sake of those people who are watching in other areas that, this is your first time seeing me, welcome. I actually was on Dr. Hampton's channel in the fall, and I've left the link to that interview below from his channel. And I also want to let you guys know that I have lost 145 pounds following this way of eating. Dr. Hampton is one of the people that I follow. I'm just going to quickly show you one of my before pictures. There I am. I'm not like that anymore. So we'll just take that away. Here's Dr. Hampton. So I just want to say a quick word. Dr. Hampton has been a family physician, board certified since 1998, and his passion is diabetes. You've written a book. It's on Amazon, and I've provided that link below as well. And you have your MBA from the University of Phoenix and certified physician executive. And like I said, we spoke back in the fall, and I really enjoyed that conversation. I felt like you are one of the few doctors out there who just go a little bit deeper. It's not just the food. It's a bigger picture. It's all the experiences of life that bring you to where you are today, and that's why I find you so exciting. So thank you for being here today, and welcome to Ketogenic Woman channel.
Yeah, thank you. It is exciting to have transformed and learning that I had blind spots. And when I started seeing that I had blind spots, thinking I was doing a great job, I was kind of forced in that moment to say, I got to do better. My patients deserve better. My family deserves better. And guess what? Even I deserve better. So I am so thankful and grateful for even influencers like yourself who make my life much easier. It's always, you have to be creative when you're trying to figure out how to eat. So, and then of course, the other experts out there who are really just trying to help people see the world through a different lens. So
Yes.
it is our purpose, even on Super Bowl night in the United States, to spend time with people so they can figure out what they need to do to heal.
Yes, and I should have said that right at the beginning. I'm Canadian. I just didn't even know that today was Super Bowl Sunday. And thank you for all of you who are here anyways. I appreciate you very much. So I do have a few questions. I mean, we are going to take questions from the audience. So audience, don't worry. You're going to have a chance to ask questions. One thing that fascinates me about you is that you spent a few years as a vegetarian, and I'm kind of wondering how did you go from being a vegetarian to being keto, carnivore? I think you lean more towards carnivore these days.
Yeah, I do. And I started my journey from the plant-based perspective because I wanted to be a great dad, actually. And so I kind of did a Google search. And when I did my Google search, I ended up with a book by Dr. Joel Fuhrman, and he's a plant-based guy. And the book was called How to Disease-Proof Your Child. And then once you go down the plant-based rabbit hole, you'll find yourself meeting other influencers and doctors like Dr. Neil Bernard and Dr. Michael Greger and others. And so that's kind of how I started my journey, thinking I was doing something for my kids. I later got intrigued by the China study, which was kind of written by Dr. Colin Campbell. That kind of really kind of was the nail in the coffin. I said, well, this is the largest nutrition study, and they're saying a plant-based diet is the key. So I wanted to follow that, not knowing the difference between observational studies and randomized controlled trial. And this was an observational study that doesn't show it only shows association and correlation. The blue zones concept kind of convinced me that was the gold standard as well. So what happened is I incorporated this plant-based ideal into my family, and we did that for a while, up to about 8 years actually. And then my wife ended up with type 1 diabetes. And once that occurred, that's when I
Oh,
really started to look at the research. And when I looked at that research, it really was clear that from a randomized controlled trial perspective, that it was like low carb was superior over low fat, which is more plant-based. So we kind of did the experiment with low carb. And then what I found is that I had an irritable bowel problem that started to get better. And then
um,
literally from that moment, I said, well, let me try keto. Let me go. And then I did that for a while, and the irritable bowel got even better. And then I went to carnivore, and that's when it was like, ding, 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 you have your answer.
wow.
And all of those things I suffered from, abdominal pain and the anxiety of worrying about where the bathroom is, gas, gas, gas. It was just horrible. And it literally just disappeared. And that was the only diet that made it work for me. So that's kind of how I landed at carnivore.
Well, that's really interesting. Now, being a doctor, did this happen while you were a doctor or before you became a doctor?
Absolutely. It happened. I've probably been in the low carb space for about 11 years now. I've been practicing for about 28 years, almost 27, 28 years. So it was definitely during that time.
Okay.
But there was no real understanding about nutrition from my training. It was just, it
Right.
didn't exist.
Right.
Yeah.
Yeah. Yeah. So, how did this change your medical practice? I can only imagine that it would have had a profound effect on how you saw these patients that were coming to you.
Yeah. Well, I grew up in a tough neighborhood, and I saw a lot of drug dealers back then. But I never thought that my medical education would turn me into a drug dealer. So I'm kind of making fun of it, but I realized instead of being a healer, I was a dealer. And really it's the conventional training. And that conventional training really only considers medical conditions like high blood pressure, diabetes, and even mental health conditions. They consider those chronic progressive diseases. There's no talk about reversal at all. There's just no talk about it. So I learned how to manage disease with prescriptions, rather it was over the counter or something I wrote on a pad. And I just basically became a dealer, and I didn't even
Mm,
know that was a problem. And then I started to learn more about, you know what is type 2 diabetes anyway? Is it really, having too much glucose, or is it something else going on? And I think once I understood the root cause and that excessive consumption of the wrong foods, particularly for type 2, was the problem, I couldn't understand why we weren't focused on that. So with the training I received, whether it was from my obesity boards training, my nutrition masters, I started to see that the veil was uncovered. And once it was
mhm.
uncovered, I started to practice differently. So now, instead of being a conventional doc who focuses on, managing disease, I now always ask the question, what is it that led to this person having this particular condition? And so it's really about answering that why question, and going back to what you said earlier, that I have a broader perspective. My perspective is not to just say, oh, you need to do low carb and it fixes everything. My perspective is to say, hey, you're not healthy. Let's figure out why you're not healthy. And we start to kind of unravel that one question at a time. So it's really turned me into a little bit of a detective. And many times I
Yes.
don't have to be a detective. Sometimes it's a handout, but being a detective helps me to honor the person's journey and their struggle, and not to point fingers and blame them. So it's really been fun to kind of see the world through that lens. And again, you
Yeah.
have to learn it on your own, unfortunately. I want to live in a world where we don't have to learn on our own, where all the doctors are trained to think this way.
Yes, wouldn't that be nice? I mean, I once had a doctor tell me that it was impossible to lose weight after the age of 40.
Wow.
And yeah, I know. And I carried that with me for the longest time. Like it was a story that I held on to and believed. And sometimes when you have a belief, it controls your actions and,
That's
so
right.
on. And, I ended up being in my 50s when I started this journey. So
Yeah, never
it's
too late.
it's never too late. It's never too late, and doctors are not always right, And I
That's right.
hate even saying that in front of the doctor, but doctors are not always right, and this is why I appreciate doctors like you so much who have shared this stuff that goes against what the other doctors are saying, and that can be it must be a bit of a scary thing as well when you're standing alone sometimes, and so it's good to see that more and more doctors are thinking this way
That's right. And it's
now.
not so scary if you see results. And it's not so scary if you can look at studies and understand them. And
Yes.
so we can't be puppets in healthcare. We were trained to think independently, to be skeptical of things. But when you get into the real world, you start to only follow guidance and guidelines.
Yeah.
So what I was able to do is to honor the part that suggested I should always question things. And if we give doctors permission to do that and we don't penalize them when they do that, then we'll have robust discussions. And so when we see people like Dave Feldman, challenging the cholesterol hypothesis, we will embrace him and say, you know what, I hadn't thought about it that way. When Nick Norris, challenged us with a
I saw that.
with the
Yes,
cookie, right? The
the
chocolate
Oreo
chip, yeah,
cookies
Oreo
bringing
cookie,
your
right?
cholesterol down.
So and all it is he's being a little facetious, but he's challenging the conventional thinking, saying if
Yeah.
this is true, that an Oreo cookie made things better, then should we then question the overall hypothesis about cholesterol?
Yeah.
So that's the world we want to live in. We should have robust debate and be comfortable challenging each other.
I think that's amazing. So you have had people now coming to you in your practice, like say somebody presents as overweight, type 2 diabetes, those sorts of things. How do you approach the subject of diet with them? Because that's probably not what they're coming. They're probably not expecting that. They're
Yeah,
expecting a prescription. So
that's
how
right.
how do you do that? How do you handle that?
It's funny when I talked to Dr. Georgia Ede, who has her wonderful book about mental health that was just released. We talked about this a little bit, and it's a little bit of a mixed bag. Certainly now, because I put myself out in the world, there are people who come to me for that reason. They're
Hmm.
carnivore, keto, and they know that I am open to that dietary pattern. But you're right. If I meet somebody for the first time, they look at me and they're like, well, I've been told the opposite of everything you've been saying. So I kind of have a little
Yeah.
quick way of kind of putting the right material in front of them so they'll be convinced that this is, I'm not a quack. But having said that, every person is different. So I tend to ask open-ended questions, and I'll ask things like, what do you think has been the biggest barrier that has made it very hard for you to achieve your health related goals? And then I'll kind of pause there, and then once I hear their answer, then I'll start walking through the things that may be barriers. So rather it's like lack of sleep. Maybe it's because they don't exercise. Maybe it's because they're under a lot of stress. So what I do is I'll start to focus on those areas. And what I find, particularly for my female um, population, is that they spend a lot of time taking care of everybody else, right? They take care of
Yes.
everybody else. And one of my favorite books that I recommend. It's a book that teaches you how to say no. It's called Boundaries by Henry Cloud. And what I like about that book is that it helps people who feel like they're out of control to regain that control, primarily by learning how to say no when it's appropriate. And I think if you're trying to say yes to everybody's request, and you're also feeling obligated that you have to, like, be responsible for their feelings, be responsible for their problems, you'll never find time for yourself. So, and what's really interesting about being an enabler is that you're not really helping them. It's almost like you have somebody who's addicted to a drug, and because they go through withdrawal if they don't get the drug, you'll give them the drug. You say, well, I don't want them to get sick, not realizing that the better approach would be to sit by them, hold their hand, and say, I'm going to sit here with you while you're going through withdrawal. That's a better model. So what the book does is it teaches us how to not blame ourselves when we feel obligated to be responsible for other people. So that's just one example, but that's an example of how I look at a person in front of me, see they're struggling, rather it's a single mom trying to raise 2 kids by herself, or that 75-year-old grandparent who's now trying to take care of the entire nest, the entire crew on her own, and she bears that weight. So my job is to help them see you don't have to bear that weight. And there's another way to do this where you'll still honor your desire to take care of people, but you'll also honor your need to take care of yourself.
Yeah, and you completely touched on, one of my questions, which was about the women that are in my age group. We've got younger people, maybe still at home, like, teenagers or kids in their 20s or whatever. We're trying to, I care gave to my mother for 5 years with Alzheimer's, and it's a real balancing act. And we will put ourselves last. Like we it's the sandwich generation that you hear about, and you're torn between these two things. And I imagine that you probably see a lot of women like that. And you also brought up, no, go ahead, because I have another point, but it can come after you comment.
I would argue that because I'm a family doctor. I used to deliver babies and take care of kids, but I'm really more of an internist now. Most of my patients are older, so I see a ton of patients who are really between the ages of, I would say, 50 and 100. And so therefore I see a lot of people who are really having a burden of doing exactly what I suggested. So again, if you give people permission and a different approach, a different way of looking at it, and them not feeling guilty, that's a better way to at least try that on for size and see if that fits. Because there'll be once you take care of yourself, then you'll have more to give the world, right? If you're just stressed and tired and fatigued, then you're not going to be able to give the world what it deserves. And so once they can kind of see that, what's really interesting is that they'll find they're still going to be doing a lot of stuff for their families and friends, but they'll be doing it in a healthy body. They'll be doing it with mental clarity, and they won't have all that fatigue and all of those things that come from not taking care of yourself.
Yes, and that's another thing that I appreciate about you, is that you really have a good grasp that, we need our good sleep. We need to lower our stress. We need to get out and get a little bit of movement, and all these things will actually help, the diabetes and the other things. And you touched on mental health.
To some relationship. We were me and my wife were listening to something for our relationship on the way home from the when we were visiting her dad. So
awesome.
You have to keep working on all of these things.
Absolutely. And you touched on mental health, and one of the announcements that I was supposed to make at the beginning of this is I always have a video of the week, and my video of the week this week was this one that you were in with Dr. Chafee and Dr. Georgia Eads, and you mentioned her book, Change Your Diet, Change Your Mind. I watched all 3 hours of that. And for people that are freaking out going, oh no, 3 hours, it was worth every minute. I mean, it was an amazing panel discussion on mental health, and there was people coming on there giving their testimonials of how, their lives basically changed. And I thought it was most amazing videos. So thank you for bringing that up as well.
Oh yeah, no.
Do you think so? Do you think that everybody needs to be carnivore? What is your view on keto? Is it keto versus carnivore, or is it, it can be keto carnivore? Like, what do you think about all that?
Yeah,
I know
well,
there's these labels out there.
they're labels. When I call myself the metabolic health doctor on purpose. When I was at the symposium for metabolic health in August of this past summer, my topic was how vegans and carnivores can live in harmony, right? So
Yeah.
I'm never going to be the guy that feels like everybody should do anything. And you could argue, and I never push back when people say humans are omnivores. Clearly, we can eat plants if we choose to. I'm not sure we'll thrive quite focused on that, but there are some people who do better when they eat primarily animal-based and they eat a little bit of a plant. So I think you have to look at the individual. I'm a big fan of bio-individuality. So, and I think carnivore is a great way to deal with specific things, which is why Dr. Georgia Ede is so important. Clearly, if you have mental health conditions, carnivore is a phenomenal diet. If you have autoimmune conditions, carnivore is a phenomenal diet. Obviously, we learned about keto and keto primarily through the epilepsy group and how our babies were being treated for that. And neurodegenerative diseases like Alzheimer's, dementia, Huntington's, those types of things are perfect for carnivore. Somebody that's having GI stomach problems like I did, and eliminate things from your diet. So doing a carnivore diet is an elimination diet. So those types of things are really important. And the other thing I want to say about carnivore that's really important to understand, it is easy. I don't have to count calories. I don't have to count carbs. I don't have to worry about hunger. And it's actually not that expensive when you're not buying all that other stuff. I did notice that you had a video out recently that talked about $10 a day. You figured out how to spend $10 a day, and you can do a carnivore diet on a reasonable budget. So if you're looking for something that's easy, affordable, and can fix most of the health conditions we struggle with, carnivore is a no-brainer. That's one way to do it. Some people like to eat vegetables, so maybe do a ketovore or a keto. That's okay. Some people want to eat a little bit more, do low carb. The key is to look at your metabolic measurements, rather it's your A1C or your SED rate or your C-peptide, whatever you're measuring. And as long as you're getting healthier, then that's probably the best diet for you. I just want to give people permission to do this diet, because if you know that carnivore is not going to harm you and yet it may greatly help you, then that may be the diet for you. And that's what I needed to do. It sounds like that's what you needed to do, Anita, but that's not for my wife's ketovore and she's fine. Nisha Berry, I think she's still ketovore. So
She
do
is,
what works for you.
Yeah.
And as long as you're happy with that and you're reaching your goals, then you're good.
Okay. All right. Well, thank you so much for that. Do you mind taking some audience questions? I think we
Absolutely.
have a few that
Let's
are
do it.
piling up here.
Let's make
All
it
right.
happen.
Let's make it happen. Thank you. So, Nuts for the Beach, is there a connection between hair loss, high sodium, and low or zero carb? Dana Spencer mentioned that high sodium can cause hair loss, but is this only while eating standard American diet?
No, I've actually seen some of this happen more anecdotally. I didn't read that particular comment from Dana or study. However, I think whenever you're adopting a different dietary pattern, it's stressful to your body, right? So just the transition from one dietary pattern to another, and I'm not saying it's specific to keto or carnivore, can be so stressful that it'll impact your ability to, not lose hair. The good news is once a lot of the inflammation and things that actually also have a lot to do with your hair loss, those things will be less of a factor. So once you adopt these dietary patterns, you should do much better in the future as opposed to what you're dealing with now. So, but I had not
Yeah.
seen the sodium connection, but again, I think that anybody making these changes should expect that that may be part of it. Thankfully for me, it's not going to be a big factor because I don't have any hair to
Right.
worry about.
Right. Okay. Thank you. And I actually did have some hair loss at some point, but it was during a period where I was going lower protein, and that kind
Yeah.
of resolved itself once I bumped the protein up again.
Yeah,
So our
protein
next
is the
question from
building blocks for
Jennifer.
most things, so that
Yeah,
makes a lot of sense. Yeah.
nails, hair, skin. So Jennifer has asked, why is it every morning my blood sugar is over 100 when I have been ketovore for almost 3 years now, no medications anymore?
Yeah. There it's a very interesting concept because once you are ketovore or carnivore, there's this assumption that my A1C should be like 5 or 4.8 or something
Hmm.
like that. And honestly, there's been some speculation. It's not 100% yet. But that some people who are doing keto or carnivore may also, because you're a more efficient machine, your hemoglobin may actually have a longer half-life. They may actually last longer. And because of how it's measured, that may then skew your numbers up a little higher. So one of
Mm,
the things that we're going to have to do as we do more research is to better understand what is metabolically normal for a person who is eating these dietary patterns. So is it normal for a person to have a slightly higher A1C because they're on this dietary pattern? And as long as it's not a problem, then we're good. And so when I talk to patients about any metric that they're measuring, make sure to look at the big picture. And we say that often because of the LDL and the
mm-hmm,
cholesterol
mm-hmm.
concerns, but we also say it for everything because there may be
Yeah,
some metrics that'll be slightly off, and you're like, man, I'm expecting this to be perfect. But if you have 80-90% of your metabolic metrics looking great, then you need to run with that. If you
yeah,
and if you feel a sense of wellness, then you should run with that. So don't get too much into the weeds. We want you to measure and pay attention, but don't be so concerned. Now, if your A1C was in a little bit higher, is considered borderline or in a diabetes range, then you want to really pay attention. And some of that paying attention is going back to, again, to what you said. What else do I need to do? Am I
yeah,
moving my body?
yeah,
Am I not getting enough sleep? So you start looking at other factors which can also elevate your blood sugar. And then
yes,
when you look
yes,
at all of that in total, start to problem solve and say, well, I've worked on my diet. Now I'm going to work on my sleep. Oh, I've worked on
yeah,
my sleep. Now I'm going to work on my stress. Oh, I need to listen to one of those, interesting lectures from the Gottmans who talk about. So another thing we should put in the notes is Dr. John Gottman and his wife, Gottman, and their Principles of Marriage book. It's evidence-based, it's research, and I think all couples should have access to that research because it tells you what works and what doesn't work based on real research. So I think that those types of resources are critical.
wonderful. Yes, thank you. Danny has a question. Can diet help bring blood calcium down? My stepmom already had a benign growth taken off her thyroid. Her doctor told her there is no diet that can help her.
And so there was a benign growth on the thyroid. I'm assuming that growth, it probably had to do with the parathyroid hormone, gland as well. And will that bring I don't necessarily think that's true that it'll bring it down. I think when you're dealing with the hormones, particularly that are responsive, that come from the parathyroid, et cetera, that's probably going to move the needle even more. So I think this is one of those situations where if we've done surgery and it wasn't solving the problem,
Mm-hmm.
we really want to work with our specialists, our endocrinologists, to kind of dive a little further, because if that was the problem and the root cause of the problem, then there's something else missing. So I would actually focus more on more of a conventional approach. Let's kind of clear that up first, recognizing that the dietary pattern will make everything better, but I have not seen that it would, impact the calcium that way.
Yeah. Okay. Thank you. M21. Oh, Dr. Hampton, have you ever done the sardine challenge? It's
Yeah.
3 days of sardines. I would like to do a variation of a sardine fast as a way to get back on track. I'd like to use fresh salmon instead of sardines. Any thoughts on this? What do you think about that? I mean, I don't know
Man.
if you've. I
Oof.
mean, I know what my response would be, and I'll give that as well.
Let
But
me recommend another video that a lot of people haven't seen. And I'm only mentioning Dr. Boz because in the video when I interviewed her, she made a little bit of a testimony about her past, which kind of threw us all off. So definitely find a video with myself and Dr. Boz on my channel. And the reason why I bring her up is because when she's a huge fan of sardines. She keeps
yes,
sardines in her purse, and I
yes,
just think that I meet people where they are. So if you are concerned about, the taste of sardines, the smell of sardines, man, salmon, you can't really go wrong with that. So I think if you use the salmon, I think you're going to do really well. Easily one of the most nutrient rich
yes,
omega-3 containing uh fatty fishes on the planet.
yes,
So
yes.
no doubt we like sardines because you get all the little bones and the collagen and all of that good stuff. Oh, I have to say this, speaking of collagen, you killed me with your video recently about the jellied pig feet, right? And what was
Yes,
funny, it
yes,
was funny to me because in the communities of color that I grew up in, I thought that only African Americans were the ones eating pig feet, right? And I knew that because of what happened back in the slavery days, the stuff that everybody
yeah,
else didn't want to eat is what we were given, right? And to hear
yes,
you do a whole video about jelly pig feet and all of the great collagen, I thought that was amazing. And then I looked it up and it said that in Mexico, Scandinavia,
I know.
there's a lot of cultures. I had no clue. I had no clue. So
You
thanks
know,
for that.
my aunties and grandma and they ate nose to tail. They ate nose to tail, and pig's feet, everything
That's right.
was eaten, and
That's right.
yeah. So
Yeah.
I know.
So
Thank you for watching
we're
that.
definitely gonna be checking that out. So I told my wife, get
Awesome.
ready.
And I agree with you about the salmon. I think salmon is, I mean, I try to have either salmon and or sardines on one of my plates during,
Mhm.
almost every day. So if I have some steak, I might have, some salmon or cod livers or something
That's
like
right.
that. Like some kind of seafood. I think incorporate more seafood is a good thing.
Yeah, and we need that
So
because I
there,
like ribeye and I take omega-3 because I'm probably not eating enough seafood. So you're really
yeah,
teaching me in this moment too. We just there's ways to get it in without, having to
there
take a
is.
supplement. Yeah.
There is, yes. So the next question is, I told you there'd be lots of questions.
That's
Is
okay.
hair thinning caused by not enough fat, protein, or ice cream?
What?
I don't know about the ice cream part. Uh, well, let's deal with the fat. And is it not enough fat or not enough protein, do you think?
Yeah, well, I do agree that people on the planet are so worried about hair thinning, and
Yeah,
I
they
deal with
are.
that a lot. A lot of my patients in the communities of color are using a lot of products, so they're very, 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 concerned about that. So yeah, I think that yeah, some of the, I mean, the first thing is we know there's other factors. There's things like stress and things like that. But if you think about the types of foods that really help you when you have hair loss, a lot of it is what we just talked about is fatty food like wild caught
Mm-hmm.
salmon. It's
Mm-hmm.
it's even beef, and beef has a ton of fat in it. So
Mm-hmm.
just the nature of that is really important to keep in mind. Also, vitamin deficiencies are the cause. People who have vitamin A deficiencies, I remember from my training, that was part of it. People who have zinc deficiencies. So when you're thinking about like, what can hurt you,
Mm-hmm.
you wanna eat the real foods. But the bottom line is when I tell people when they come to me and I say these are the things they need to do for to improve their hair, one of the things I talk about is high potency omega-3. And so that's very fatty. And so naturally, I think that that's a big part of the solution. The other part of the solution is to, again, reduce inflammation. But my
Mm-hmm.
experience has been that from an indirect perspective, that fatty foods help, which suggests that that's part of the equation. However, we talked about protein, and the good thing about animals is that you get both, and really the essential amino acids. And we think about biotin and things like that when it comes to hair, but all of these things, are really rooted in essential amino acids as the building blocks. So, arguably, I think that the amino acids are maybe even more important. So if we eat from the perspective of higher protein, I think that that's going to, what I've seen in practice, is that that gives people the bigger benefit, but there's also the benefit coming from fat.
Yeah. Yeah. Okay. Good. Thank
But the ice
you so
cream, I'm not
much.
sure about that one.
I don't know about the. I think that she might have just thrown that one in to, Ingrid and Carlos. Hello, Dr. Hampton and Anita. I wanted to know what you think about diet sodas and sweeteners for a diabetic person as a replacement while starting a low carb keto carnivore lifestyle.
I think what's really good about that question is while starting. And when you're starting, I
Mm-hmm.
think we want to give ourselves more grace. I mean,
Yeah.
people, you bring up sweet things, there's a lot of emotion attached to it. And so it's nice to
Yeah.
know that we have alternatives. So what I would say is, what's the worst thing that can happen to a person with diabetes? And that's getting all these insulin spikes. So the first goal is not to get into the weeds, but to stop the insulin spikes. So if
Yeah.
I take a zero soda or a diet soda, I probably won't get insulin spikes with that. So as a physician who's trying to walk with people, I'm totally okay with a person transitioning from the, 5 sodas a day, that's the normal soda, to maybe a zero. It's going to have some, artificial stuff in it that's not healthy.
Yes.
We understand that, but we're not getting the spikes anymore. And then some people will transition to what they think are healthier types of sweeteners, like pure monk fruit, pure stevia, as an alternative. That's something to consider. They even have a Coke that's made with, I think, stevia. But I think the better model is to use that as bridge therapy, and
Yes.
we transition with that, and then we go to a dietary pattern where we don't put the fuel in our body that's not really adding value. So a diet soda does not add value. It's like empty calories. It's
Mm-hmm. Mm-hmm.
artificial stuff. It's who knows what kind of dyes and things they have in there. So I think it's better not to use that long term, but short term, feel free to transition with that,
Yeah.
because if you get our goal is to just, let's fix this diabetes. That's the goal. And then we can
Yes.
deal with this other stuff down the road.
I love how you answered this question because I often think to myself, if I had been on social media when I first started low carb, I was dirty low carb. I mean, I had
Right.
the diet sodas and I had,
That's
the
right.
low carb treats. And, today, if somebody says, "Oh, is this any good? Can I have this?" They can get some hate,
Right.
and I that bothers me because everybody's got to start somewhere.
Right. Right.
You can't know all the things in your first week, right?
You just can't.
So,
And it's not
thank you
necessary.
for
Yeah. No, yeah. Again, we got to meet people where they are. Nobody's
yes,
trying to be
yes,
perfect here. We're just trying to be better next year than we are today. That's it.
exactly,
Yeah, just better.
exactly, yes. Okay, Dr. Tony, this is from Bonnie. Would you comment on your thoughts of the connection between obesity and the microbiome?
This is something that I had to think about a little bit, because when I started my journey for to improve my irritable bowel, I did get better when I took probiotics. I was using a company called Protrin or Natrin. I actually interviewed Natasha Trinev, who is the mother, believe it or not, of probiotics, on my YouTube channel. And so, um, what she believes that you have to take these things to have a, because it is true that the world we live in does not have the bacteria on the fruit and maybe in the guts of the animals that it used to The animals are
Okay.
being fed antibiotics and other things. Now, having said that, it's clear that my microbiome affects how I feel. Now, her question is more about obesity. And at the end of the day, there's if you have too much Firmicutes bacteria, as an example, you're gonna be overweight. If you have too much Bacteroides, you're gonna actually not be overweight. And if I take the Firmicutes out of a person whose largest belly and put it in mine, I'm gonna get overweight. So we know that the microbiome does matter, and it's definitely a connection. The good news about low carb keto or carnivore is that it shifts your microbiome from its current state to a state that's more favorable. So in other words, if you're not high in Bacteroides before you start low carb keto or carnivore, you will actually shift there just because you change your diet. Because the different foods that you put in your belly feed or favor different types of bacteria. So if you put
Okay.
the right food in your belly, then you'll get the right outcome. So now the problem is they haven't really seen, it takes a lot of bacteria to change your microbiome. So they haven't, in order for it to be affordable and more available for the public, for us to use this as a treatment modality like probiotics, they haven't really gotten to the dose that's gonna work. So right now it's still kind of in theory. We know it's gonna
Mm-hmm.
probably work. Eventually they'll get there, but right now it is theory. So since we can use our diet to fix it anyway, let's just do that, and then we won't have to
Okay.
worry about it. So I think it's good. It's a good question because it is it's like ongoing science, but it's not really ready for prime time yet in a way that we would like. Now,
Right.
Natasha and her team at her company, they're doing research. They're using probiotics for I think it was autism and other conditions that have shown to improve. So we know it matters. But we also know that the microbiome of a carnivore is going to look different than a microbiome of a vegan. And it doesn't mean either is better. It just means it's different because they have different needs based on what they're eating.
Okay. Okay. That makes sense. Okay. So, question from Adam: reversed duodenal switch, malnutrition, blocked intestine, muscle loss. Would temporarily bringing back carbs be beneficial to gain back muscle?
Wow. Yeah. I mean, that's like that's it's an interesting question because um, when you there's some benefits of having some carbs. Like a lot, if you think about the bodybuilders, right? When they're trying to gain a little muscle, they actually will increase the carbs a little bit because it kind of can serve as a little bit of a fuel source to replenish those glycogen stores in your muscle. So there's logic in having some carbs brought back when you have a specific goal for a specific amount of time, or when you're trying to fix something, right? So the way I look at it, when I think about Professor Tim Noakes and others who was doing marathons and he still was borderline diabetic, right? Which doesn't make any sense. But so for certain people who have specific goals, like I'm trying to recover from something, or I'm trying to prepare for my my weight training session, there may be value in the short term. The long-term benefit, I think, is not necessarily borne out because in most cases, if you're a patient, you'll be able to do exactly what you need in terms of making sure you're building muscle, because the primary source of the fuel, the foundation for muscle, is essential amino acids. So if you're trying to do it at a faster clip, maybe you can do that with this approach. But for me and most of my patients, we're patient and we just give ourselves the essential amino acids that will then allow us to build the muscle. And it's a beautiful thing because when you feed yourself, if you think about Dr. Anthony Chaffee, when I interviewed him, I mean, he says, I may get to the gym once a week, sometimes every 2 weeks, and he still looks like he's working out every day. And that's because he just does, right? So, but
He
that's
does.
because but if you give your body the right fuel, which is those essential amino acids, which is all he eats, then your body will kind of keep the ship level, even when you're not doing the stressor of trying to stimulate muscle growth. So the protein is the key. And if somebody temporarily in a safe way were able to add some carbs back to accelerate it, that would be okay.
Okay. Thank you. Anne would like to know if carnivore is the best diet for low thyroid. I'm not even going to pronounce that, but still feels tired daily.
Yeah, I think any lower carb diet is probably better for most of our hormones because we get the fat and the cholesterol in our diet that impacts all of our hormones. Now, again, when you're not. So the first thing I would do if a person's on levothyroxine is to start thinking about, is that the best form of thyroid hormone that we should be taking? So that's number one. I would also make sure the doctor is not just checking a TSH. I want to check the antibodies. I want to check um, the free T3s and the free T4s. So you want to kind of get a better picture of what's going on. And the reason why that's important is because let's just say you have Hashimoto's, which I think Nina Taisho, not Nina Taisho's, where did that come from? Where Nisha Berry has, and basically, if you know you have an autoimmune disease, right, and that's your etiology as Hashimoto's, then yeah, I think this, and I mentioned earlier, all autoimmune diseases do better with this dietary pattern because you heal your gut more effectively. You get those tight junctions in place. And once you stop the onslaught of more things that stimulate your autoimmunity in a negative way, then you can start to heal. So from the perspective of what type of diet, what type of thyroid problem do you have? If it's an autoimmune, then carnivore is a slam dunk. Keto is a slam dunk, but carnivore is probably better. But if it's not that type of thyroid condition, you want to start thinking broader of, what else is going on that's making me tired, and start focusing on that.
Okay, thank you. Marilyn, why am I having higher blood pressure after losing 30 pounds and being carnivore for over 2 years? Age 65, weighs 125, jogging, walking. Blood pressure can range from 130 to 155, over 80 to 100.
Interesting. So, and it really does cause a lot of pain when you do so much. So, when I think about blood pressure, I do think about some various factors. One is if a person's on a high insulin, then they're going to have a problem with their blood pressure. I doubt that's her story. If a person has a genetic predisposition to a high blood pressure because of the family history, it's going to take them much longer to achieve the improvement in the arteries that are being impacted. The biggest factor is what she's already done. Being carnivore eliminates the carbs, and carbs is the biggest driver of too much insulin being produced. And when you have too much insulin, you're going to have an issue with vessel constriction. You're going to have an issue with absorbing sodium. You're going to have an issue with inflammation. So she's kind of done that piece. And I think it may come down to how insulin resistant she was prior to this occurring. And my experience has been, I can get somebody off their diabetes meds within weeks, but the blood pressure can take months. It can take a few years. I honestly think that she just needs more time. And it may be okay. Like one of the supplements that is helpful, which is citrulline, that's something you get from watermelon pills. Now, this is more plant-based, but that turns to arginine, and then that turns to nitric oxide. So that may be a mitigating step, a supplement to consider to kind of help the body along. And the exercise I would have mentioned, but that looks okay. I would then look again at the sleep and the stress. And if those things are still places where there's blind spots, I would work on those. But I would be more patient. It sounds like 2 years is forever, but who knows how long she's dealt with this. And we need more time. And I'm not concerned. Now, last thing I'll say, I'm still a conventional doc. So whenever I see somebody struggling, I say, well, let's see, is there some renal artery stenosis? Is there some other secondary cause of blood pressure. So if your doctor haven't done this yet, ask your doctor, could you do a complete evaluation of secondary causes of elevated, I think there's pheochromocytoma. It's like a tumor, right? So there's all of these hidden causes of elevated blood pressure. And if she simply just Googles secondary causes of hypertension or, uncontrolled hypertension algorithm, she'll see like a pathway for which these are all the tests you need to do just to make sure we cover all the things that could also cause
Yeah.
an elevated blood pressure.
Okay. All right. Thank you. And I've heard that before too. There has been a lot of talk about this out there.
Yeah.
Okay. There's another question about high blood pressure, but I think everything you just said now, I think it was basically the same question. So Cindy, if you're out there listening, I saw your question, but I think the answer he gave applies to you. Low carb spin. Hello, guys. What are the percent of fat versus protein on carnivore? Heard a lot of people on carnivore eat too much fat and can actually gain weight instead of losing.
Yeah. It's and again, I don't know that it matters in terms of what's going to get results. So ultimately, you want to define your success by results, right? But though for those who are measuring, right, it's really kind of keto oriented, right? So I expect people with this dietary pattern to have it's going to be high in fat, to be honest with you. Don't be surprised if you're in a 60%, some are as high as 70% fat range. So it's kind of, and then you got the 20% protein, and then you got the, I'm sorry, 30% protein if you're carnivore. So I think in that, 60-40 range where it's, fat to protein, or it can be 70-30. I think that's where you're going to land, but kind of think of it as really another form of keto. It's just, you're just eliminating the part that used to be carbs, and you're replacing that with protein. So, and if you do that, you'll do well. We do need fat though. If you're going to feel good and not have all the negative effects of transitioning, and not, some people get constipated, some people get diarrhea, right? You'll have to kind of look at that fat proportion and adjust accordingly. I'll be honest, I don't think it's the same for everybody. I think everybody's different. So you kind of play around with that a little bit until you get to a good place.
Yeah. The fat is a good lever for your bowel.
That's right. Yes, it is.
Yes.
Thanks
for the question and the answer. Sherry, do you recommend intermittent fasting in any particular eating window?
Yeah, I think you base it on what feels right. Since most of us are not that hungry when we eat this way, then fasting becomes easier. I think women need to be more careful. Our younger women who are still going through their cycles may find they struggle more, maybe, 10 days or so before their cycle, because there's so much hormone stuff. And during that time, it's okay not to fast, or it's okay to maybe do a milder version of it. Guys tend to tolerate this more. I do think that I personally eat between 12 and 7 every day. So I kind of have that, 16-8 kind of thing going. I try to do a different model where I would just eat between 4 and 8. And I think that's nice because you can get a little bit more of an autophagy where you're kind of getting rid of the cells that are not really useful and replacing them with healthy cells. However, I couldn't get enough protein in. I just couldn't. I felt like I was stuffing myself for 4 hours just to get it in. I don't want to live like that. I don't want anybody else. So the biggest lever that's going to determine whether you do intermittent fasting or not, even with or without the benefits, is based on how you feel. We want to enjoy our journey through life, and we may listen to our experts like Dr. Atia and others who may say, hey, this is a good thing to do. I remember recently Dr. Peter Atia kind of was doing this metformin thing for longevity. Now he's saying not so much based on the research. So everything's evolving. So even if you get like the perfect recipe of longevity and success and being healthy, it may change 10 years from now. It may change 5 years from now. So the best barometer is the best experiment is the N of 1, the one you do yourself. And if you do a type of intermittent fasting where you're have an 8-hour eating window, or you're eating in a 4-hour window, or you're eating once a day, the only one that really matters is the one that you like, the one that makes you feel your best. And if you go with that, I think that's great. Just keep in mind, we all believe that there's benefit, but the benefit may not be as important as the results and how you feel. And if that, because at the end of the day, we all get our card called at some point. We just want to, I just want my, if I'm blessed to be 95, I just want it, when my card is called, I just want to make sure the life I lived before 95 was a quality of life. And I wasn't so concerned about the details that I couldn't live. And
Yes.
maybe I was
Yeah.
so worried about the details that the stress caused me to die anyway. It's like,
Yeah, we don't want that. We don't want
no,
that.
no, no, no.
Okay, I don't know if we're going to get to all the questions.
Yeah. I know it's
Some
getting
of them
late,
that
but
you've
we'll,
partially
yeah.
answered, but here's one that I think a lot of people my age must be thinking about. Will a higher protein intake be more beneficial for osteoporosis?
Yeah, honestly, the most important thing for osteoporosis is I'm going to start with exercise. I mean, think about it this way. So we know most people who are worried about osteoporosis, they're being told they need to do vitamin D because vitamin D will increase the calcium. Always do vitamin D3, K2. Based on the evidence we know now, is D3, K2, right? Because the K kind of moves the calcium out of your joints, no arthritis, out of your arteries, no heart disease into your bone, right? But so the vitamin D and the K2 is probably more important, but you also need magnesium to help the calcium to be metabolized properly. So that's something I want you to think about. So my impression, I don't think about it this way. I think about it, I need muscle and I need to exercise. That'll then strengthen my bones, but I need protein for my muscle for that purpose. But when it comes to directly related to osteoporosis, I think it's more about the vitamin D, the K2, and the magnesium, and making sure
That
you get
is
those. Yeah.
good to know.
Yeah.
Okay, we're going to take a couple more questions here. Oh, you just talked about
That's
vitamin
so
D
funny.
levels.
Let's give them a amount. So if you took 10,000 a day, it wouldn't hurt you, but most people are taking 5,000. So if you find a D3K2, most of them that are really high quality, I use a liquid dropper. It's about 5,000 vitamin D3 and about 200 of the K2, and that proportion tends to work really well.
Okay, thank you so much. So here is one that maybe this. Oh, actually, I'm going to take one more before this one. Hang on. Low sugar kombucha. Is it bad for you? It's my one guilty pleasure that I drink about once a month as a treat.
Yeah.
What is kombucha?
It's
anyways?
basically fermented tea.
Okay.
What's cool about kombucha, when I was in college in New Orleans, we used to, have beer and crawfish every Friday, right? So kombucha, it kind of has that beery kind of taste. It's acidic, and
Okay.
it tastes like it's some alcohol. I'm convinced there's some alcohol in it, but that's, maybe they can put some comments in there and verify that. My wife says there is. So if I'm having a indulgence day and I want that guilty pleasure, I love the way she described it, guilty pleasure. Take the guilty out and just say, I'm having indulgence. I'm gonna have a moment of pleasure. They do have some, if you're not making your own, which some people can make. If you make your own, you can make it as like 0 sugar. But some of the stuff in the grocery stores will say as low as like 3 or 4 carbs, 6. You try. So if you're gonna have these moments when you want to indulge, you definitely want to do it at that level. I personally don't think that they're bad for you. I think they can impact your microbiome, so you have to be careful with that. They do have probiotics in them, so in theory, they should be good for you because they're fermented, which has the good bacteria. So this is another example of let's test how it makes me feel. If you do something once a month, it really doesn't matter. If you decide to do it more frequently than that, and you're kind of creeping into the Ketovore category, in that setting, just get the lowest carb
Yeah.
version you can find, and they have plenty of those. When I go into the grocery store, you will see some at 4 and 6, and you'll see some at 18. So just get the ones that
Okay.
are lower. And if you eat the one at 18 and you're doing carnivore, it's going to taste like somebody poured sugar in your mouth. It's just you're just not used to that
Yeah.
sugary
Yeah.
taste anymore. Yeah.
Okay. We're going to end on this question because I think it's a good question, and people want to know, Dr. Hampton,
Ah,
what do you typically eat in a day? How
yeah.
often do you eat, and do you fast at all?
Well, the first thing I want to say is I do fast. I do intermittent fasting. My wife's ketovore, so I will have whatever animal I'm eating. My favorite is ribeye, uh,
Mm-hmm.
but we'll eat anything. We'll eat corned beef, even though that's a little processed. We'll eat, baked chicken. We air fry a lot of food, so I'll eat some air
Mm-hmm.
fried wings and things like that. My wife may then also have some yellow squash. She may have some green beans. So she'll eat one
Okay.
vegetable. She's
Yeah.
comfortable with that now. So I think, but let me tell you what I really appreciate. And I'm going to mention you and Maria Emmerich. And I'm sure there's others that I haven't, there's tons of people because I've heard you comment on, you'll literally comment on stuff you saw and you're kind of doing your version of that.
Yeah. Yeah.
You got, you know, I, we live in the real world, guys. And for me, we now can make a lasagna that's either keto or carnivore because of
Yeah.
Maria Emmerich, right? And we have Anita that's also, doing crazy stuff with pig feet. I don't even want to go there again. But and I love that recipe, Anita, because it was so simple. Just like you said in the video, it was
Yeah.
so simple. And so for everybody that's checking us out, you decide. Like we made a pizza with the with ground chicken as the crust, right? It was delicious, right?
Yeah. Those are good.
I mean, it's so good. It tastes
Yeah.
and what tastes better, flour, dough, or chicken? I mean, of course the
Exactly.
chicken tastes better. So for me, I'm still evolving. I've only been carnivore for a year and a half, which is why I need others to kind of give me ideas. But I'll be honest, if you gave me a ribeye every day and every so often, I like lamb. To me, they're very similar, and maybe chicken. We do salmon. We do all the meats, to be honest.
Mm-hmm.
But
Mm-hmm.
ribeye is still my favorite. Tomahawks are still one of my favorites, and that's all I basically eat. I usually for lunch I'll eat the leftover kind of some meat from the previous day.
Yeah. Yeah.
I'll have like a half a chicken, and then for dinner I'll have a ribeye. So that's kind of like the theme. Some type of meat for lunch and for dinner. I try to eat a nice portion, so I'm maintaining my muscle, and it's really that simple. Do I eat
Yeah.
breakfast food sometimes? Absolutely. If I'm working from home on a Wednesday or on a weekend, bacon, sausage, and eggs are kind of what we do. Every once
Yeah.
in a while, we'll do a chaffle, so we'll mix it up a little bit. If I do a chaffle, she may use a monk fruit flavored syrup. I'm going to just use maybe some whipped cream,
Yeah.
and that's it. So I try to live up to the carnivore theme as much as possible because my body likes that. The good news about this is if you do this and then things get a little, uh, if you deviate and you're doing ketovore because you've healed, a lot of times you don't even notice it. But if I do that multiple days in a row, then there's going to be a problem. So
Yes. Yeah.
I just try to honor what I know works for me, and I appreciate that question.
Yeah. Okay. Thank you so much, Dr. Hampton, for coming back. I think I apologize to anyone whose questions we didn't get to. We're just going to have him back
Yes,
sometime, right?
yes,
That's
yeah.
really the only answer that makes
That's the
any
only
sense.
answer. We're gonna do this again, and I'm gonna keep checking out
We're
the
gonna have
work
to
you're
do this
doing.
again.
That's
Yeah.
right. I love it.
So
Thank you so much.
yeah. So yeah, everybody, go back to the Super Bowl if that's what you were
That's
doing.
right.
Thank you so much for spending this time with us, even on this day of Super Bowl. And have a great rest of your Sunday. And we'll see you guys next time. All of Dr. Hampton's information is below. There's links, his book, his channel, the previous interview we did. It's all below. So we're going to say goodnight now. Thank you so
Take care,
much.
guys. It was my pleasure.